As an economist, I appreciate the efficiency and the effectiveness of public Medicare. A key component of that system is federal funding. The way we got Medicare right across the country was through federal cost sharing. Over the years, that federal funding diminished as a share of healthcare costs, and the latest healthcare accord, the 6% escalator every year, was an attempt to restore a meaningful level of federal support for public Medicare. It's really unfortunate that the Conservatives have gotten rid of that 6% escalator. They've replaced it with increases in line with the growth of the economy. So it's not only a lower level of funding, but it's a less predictable level of funding for provincial healthcare administrators. Part of it is an austerity agenda. The Conservatives want to cut back public spending overall, but I think there's also a drive to try to privatize many aspects of the healthcare system, and underfunding public Medicare is a way of creating a justification for private alternatives. Here in Saskatchewan, there's a tremendous resource wealth that belongs to the people of the province. Unfortunately, the provincial government sells off those commodities at very low prices to the companies that extract them. So the province isn't collecting as much royalty revenue as it could, and that's part of the reason that there's this supposed lack of funding for healthcare. Now, in terms of the reductions in federal transfers, I would really point to federal corporate income tax cuts, where the federal corporate tax rate has basically been cut in half since the year 2000, from 29% down to 15% federally. That's billions of dollars that are not being collected every year in corporate taxes, and those dollars certainly could be put to good use in the public healthcare system. It was just recently revealed that Cameco exploited a Swiss tax haven to avoid paying $300 million of provincial corporate income tax and another $500 million of federal corporate tax. So there's no question those dollars could be well invested in public services like the Medicare system. Health is really seriously affected by people's incomes, their living conditions, their employment status, and I think a lot of it is common sense. I mean, if you explain to people that, the poor are going to have worse health, people understand why that is, and I think we can often make the argument that, alleviating poverty is not only great social policy, but it also saves the society all kinds of costs in terms of policing or the healthcare system or other services that are needed to deal with the consequences of low income and poor health. The message should be not only that Canadians want to keep Medicare as it is, but that we also want to improve it, that it would be far better to have a Medicare system that also encompasses pharmaceuticals, mental health, dentistry, other areas that are essential to health care, but for whatever reason fall outside the current Medicare system. So if we really believe that Medicare is the best option, we should not only be defending the status quo, but trying to expand the public system out into these other crucial areas of healthcare.